so what we have here is this chemical soup. And we know from studies that have been done that when silicone implants are heated to body temperature, that can result in gel bleed, silicone gel bleed. So you don't have to have a rupture for these things to be leaching into the lymphatic system and traveling throughout the body and kind of gumming up your drainage organs, your liver and your kidneys, your lymph, things like that.
Sarah, thank you so much for joining the show.
Thank you so much for having me, Wendy. It's such a pleasure, sharing this really important information with your audience. So I'm really happy to be doing it.
Yeah. So tell us a little bit about yourself and how you got into the health field.
Like a lot of us, this really comes from a place of our own experience with chronic illness, this pain to purpose kind of scenario where you go through something, you discover that the conventional medical model really isn't able to help you in the way that you need help. And so we go down this path of trying to figure it out and, digging for more and trying to learn more and acquiring more education to try to heal our own bodies. And so that's kind of what it was for me as well. I was the picture, I guess I would say, of perfect health as far as the fact that I just, never had a symptom to speak of. I was in great shape. I had, no physical outward, evidence that I was, in poor health of any kind or suffering from any kind of conditions. And I was working night shift as a nurse. I had been doing that for 5 years and was really into physical fitness. And I think that next step for me in my fitness journey or lifestyle was getting breast implants. And, that desire actually came from childhood. I think this is a really important point because we have to be so careful what we speak out loud to our children and just understanding how much they are just like little sponges absorbing the world around them and making meaning out of that. And what you say sticks with them. And that's what kind of happened in my life is that someone really important to me said to me one day when I was probably 10 or so, we were talking about, she was saying, suck in your stomach, stick out your butt. Like this is all posture stuff. She was trying to teach me to, have a beautiful appearance. And no one wants to see a belly hanging out like that. Suck it in, And then she told me, another day she had said, you're going to be 4'11", just like me, but don't worry, because you're going to have the Johnson boobs. And it was that comment, I think, that really stuck with me my entire life, that if I didn't get the Johnson boobs, that there was something wrong with me, that I wasn't pretty enough, womanly enough, sexy enough. And I saw my mom, who's also small chested, get teased a lot in our family. And so I didn't want that to be me. I wanted to be in the Johnson boob club and I wanted to fit in. And I wanted everyone else to, see that I became what I was supposed to, or what I thought I was supposed to. So fast forward, of course, I finally made that decision that I had been wanting my whole life that I never achieved naturally, had my breast implants placed. And, it wasn't love at first sight. I really struggled emotionally with that new image. When I looked at myself in the mirror, it wasn't me. It wasn't my body. It wasn't the body I was used to looking at for the past, 15 years. And
so when you first get them, they're like up to your neck. They place them really high. So they, I guess, settle over the next few years, but it's weird looking.
Yeah, it is. And so I was doing everything I could to get them to settle faster. But, it was about, I would say within 6 months, I started developing unusual symptoms that were rather unexplainable. And so, my initial symptoms were fatigue and hair loss, period problems, acne, irritability, anxiety, insomnia, things like that. So I thought, and being really cold, like freezing cold, especially at nighttime, I would go to bed with a hot pack because I just couldn't keep my body temperature up, and some weight gain, things like that. And so initially I thought, well, this might be my thyroid. I probably should get my thyroid checked. Conventional medicine said, no, your thyroid's fine. Maybe, One thing was low sex drive too. So the comment was maybe you should seek, therapy and further depression or anxiety and maybe, spice up your sex life. So I knew that wasn't the answer, and I kept digging. I kept searching. I finally, found a different doctor, a naturopathic doctor who, I just sent her my labs. I said, if I, spend the time to come and see you, will you treat me? Because clearly I can see an issue here. And she said yes, but that approach still was just more of like a Band-Aid with supplements rather than a medication. It wasn't ever really getting to the root cause. So symptoms started to progress. I started developing IBS, gas, bloating, loose stool, food intolerances. I could tolerate like almost no foods. Severe anxiety to the point where I couldn't really be in public. I couldn't be in large crowds, noise sensitivity, sound, smell sensitivity, chemical sensitivity, any kind of stimulation just threw my nervous system over the edge. I couldn't tolerate my workouts anymore. It was too stressful. I couldn't tolerate any kind of stress whatsoever. My period problems got a lot worse. I ended up developing stage 4 endometriosis. And so it goes on and on. I ended up getting diagnosed with all these different infections and, gut infections and Lyme and all these things that were going on in my body. But what was never explained is, why is this happening? And I even asked one of my functional doctors who I was working with at the time, because I had the intuition to ask the question, could my breast implants be a part of this picture? And his answer was, I think that if we address these infections, that your implants won't be a problem. I think your body is just, your immune system is just in overdrive because of all these infections. And so, I put that on the back burner. And at the time, no one was talking about breast implants or breast implant illness. I even did a Google search one day asking Google, symptoms developing after breast implants or breast augmentation, and nothing came up. There was nobody talking about this. So I couldn't just go off of a hunch. I just kind of, progressed down this journey of just trying to address all these things that we were discovering on lab work. And I did get up quite a bit better. I did some detox work. I did some detox work with you, Wendy. I, addressed a lot of gut things and, Lyme and things like that. And I did get better, probably about 50% better. So that's kind of where my journey started. I ended up going down the path of becoming a functional diagnostic nutrition practitioner because of this, so that I could try to figure myself out, and then doing more advanced training beyond that, because it did require more than that to heal my own body. It wasn't as simple as diet and lifestyle and things like that. I had to do a lot more.
Yeah. And it's really problematic when you're trying to get to the root cause of what's going on with your health. But because your health steadily declines with the breast implants, it's so easy to chalk it up to infections or other health issues that seem like very obvious causes of your symptoms. Right. Yeah, it just makes it hard to diagnose what the root cause is.
Yeah. And I think there's so much crossover between, as far as like the symptoms you may experience with breast implants, and all kinds of other disease processes. Right. And so it's really hard to pinpoint, especially at that time in my life where, it wasn't easily accessible or easily discoverable information on the interwebs.
Yes, exactly. And so tell us, what is breast implant illness? Because I've been on groups where, there'll be 50,000 women on a Facebook group for breast implant illness, also known as BII. And so tell us a little bit of those symptoms, symptom clusters and what that looks like.
Yeah. So, I think there is a lot of research that's still needed to really truly understand breast implant illness. There's a lot of theories out there. A few of them are pretty prominent. So, when I talk about breast implant illness and I teach women about this, I generally talk about the fact that, this is a very generalized term. And I don't even love the term breast implant illness because it gives the breast implants all of the credit, when in my perspective, they really are deserving of just part of the credit. Because, I don't believe that chronic illness begins or ensues for just one thing, because of just one thing. It's usually multiple things that are going on in the body. And so this is kind of more of a generalized term given to this process where vague symptoms, chronic symptoms develop following breast augmentation, either with silicone or saline. And, it can happen at any point. For me, it was fairly quick. For some people, it's even quicker than that. Some people, it's within days of augmentation. And for others, it could be decades later. They just start developing symptoms out of what seems like out of nowhere. And so it can be characterized by things like chronic fatigue, cognitive dysfunction. So those two things were also things I experienced: severe brain fog. I had to read something probably 10, 15 times before I could comprehend it, understand it, and really know what I was reading. Poor word retrieval, memory loss. So, when you're in mid-sentence and you can't think of a really common word or somebody's name, things like that. Muscle aches and pains, joint pain, hair loss, weight gain or weight loss, temperature intolerance, low libido, ringing in the ears, heart palpitations, shortness of breath, night sweats, skin rashes, insomnia, hormone imbalances, swollen or tender lymph nodes, numbness and tingling, body odor, muscle twitches, vertigo, frequent urination, sensitivity to light, sound, chemicals, feeling like you're aging pretty quickly, visual disturbances, liver and kidney dysfunction, GI issues like I described, food intolerances, different infections that are persistent and don't resolve, like viruses, bacteria, fungus, parasites, things like that. Difficulty swallowing, chronic inflammation in general. Some people report feeling like they're dying, headaches, dizziness, migraines, mood swings, emotional instability, anxiety, depression, panic attacks, suicidal thoughts. And so it's just such a long list.
I mean, that could be anything.
It could be anything.
Symptoms, that's why it's so difficult to gonna pinpoint this. And I had breast implants also. I had mine explanted it's going on 5 years now. And I definitely, I felt like I had pretty good health before, but there were definitely problems. There were definitely issues and fatigue and not sleeping well and trouble, like feeling like a train wreck in the morning. And there was definitely a lot of symptomology going on that I just thought, oh, I'm just getting older. Nothing major. But after I had them out, I did feel better. And I was very, very happy that I explanted. And I think that a big roadblock for me not wanting to explant was worried I was going to have Franken boobs. I was worried I was going to have, my breasts weren't going to look good, or we wouldn't be big enough anymore. But lo and behold, I have boobs. I like smaller boobs better. I never wanted big, huge boobs that my doctor gave me. And most models, they have small breasts. All these supermodels you see in the magazines, they have very small breasts, even though they have boobs, they're taped up. They tape them up and put them on push-up bras, and they don't have boobs. So I think for me, I'm really glad I had it done. I had a breast lift afterwards. So I do have some scars, but my scars have healed really, really nicely. And I'm super, super, super happy that I did it. But, you have to go find the right doctor, and, you don't want to do, budget shopping for, explant surgery, which some people might be prone to do. And for me, it costs $15,000. It's definitely not cheap. It's not typically covered by insurance. So it's just costs $5,000 to put them in and $15,000 to get them out. So not an easy pill to swallow.
Right. And it's an expensive result of having them placed, having to get them out again. But most people, I don't know how many people's doctors tell them that they're not a lifetime device, but more often than not, that's what I hear is that my doctor never told me that I need to get them replaced. And, replacing them every 5 to 10 years is also very expensive to do. So either way, you're spending money on the maintenance or getting them out.
Yeah, I had mine replaced at one point because the first time I had my breast done, the doctor cut some ligament that holds your breast to the side. He just didn't do it properly. So I was like the uniboober. I didn't have any cleavage. My tissue was raised in the middle of my breasts. So I had to go and get a revision at that time. And it was just another $5,000 to do that. It was just a nightmare.
Yeah. It can be a money pit. That's for sure.
Yes, it is. And so let's talk about breast implants and how they impact like the body, the hormones, the gut, detox pathways, et cetera, and whatever other organs that they can impact.
So I think of breast implants as a stressor on the body in a couple of different levels. They're a foreign object, of course. So the body knows they don't belong there. So they're a physical stressor that stimulates and kind of tires out the immune system. And they're continuously activating the immune system. And that eventually results in immune dysregulation. And a lot of people end up with autoimmune conditions as a part of this picture. And so they can end up overstimulating the immune system. So this can lead to what I have seen is a muted immune response in other aspects like pathogens in the gut or more systemic pathogens. The body is maybe too busy here dealing with this to also fight off what else is going on downstream. Right. And that results in lots of overgrowth of different opportunistic organisms. So bacteria, fungus, like candida, viruses, parasites, things like that. And so they kind of grow unchecked by the immune system. And then I often see reactivation of once dormant pathogens. Things like Epstein-Barr can become a problem for some people. Pathogens that cause Lyme and their co-infections can also become a problem for some people where it was never a problem before. And so this is where you'll see certain autoimmune triggering bacteria can also be overgrown. Things like Citrobacter, Klebsiella, Prevotella, Proteus. And I oftentimes also see low gut immunity on a stool analysis. So low secretory IgA, and that's in every mucous membrane, but we can evaluate it in the gut. And, so that's your body's first line of defense against a foreign invader that's entering your body through food or water. So it's an immunoglobulin that binds to pathogens for elimination. And so if you don't have enough of this, if your body has been trying to fight things off for so long that it starts to downregulate production of secretory IgA, then you end up with a really, really poor gut immune function. And that paves the way for even more bugs to colonize and create problems in the gut, even more imbalance, even more toxic terrain. And so with this depressed immune system, the gut is left, defenseless. And then secondly, also a part of the same picture, breast implants are a chemical stressor because, these implants, especially the silicone implants, but also saline, are full of cytotoxic and neurotoxic and carcinogenic chemicals and heavy metals. And those things are highly inflammatory to our cells and our tissues and our organs, in addition to the silicone. And so, we know there are almost 40 different toxic chemicals and heavy metals in silicone breast implants. And so these are things like methyl ethyl ketone, cyclohexone, acetone, xylene, phenol. Those are all neurotoxins. And then you have things like dichloromethane, toluene, benzene. Those are carcinogens. And you have things like talcum powder, formaldehyde, lacquer thinner, printing ink, metal cleaning acid. What are these things doing in breast implants, right? I mean, who thinks that all of these things are going to be found in their implants? And then you have certain heavy metals like aluminum and tin and lead and platinum. And personally, I developed a severe allergic reaction to my wedding bands that are platinum when I had breast implants. And after I had them out, that reaction went away. I couldn't wear my rings for years because it just created this ring of fire around my finger. And so I think it was because of that I developed this reaction to platinum. Platinum isn't typically a high reactive metal, but it definitely became that way for me. And so silicone in itself has been called an adjuvant connected to certain autoimmune conditions. So that can also be a trigger for autoimmunity to develop. And so what we have here is this chemical soup. And we know from studies that have been done that when silicone implants are heated to body temperature, that can result in gel bleed, silicone gel bleed. So you don't have to have a rupture for these things to be leaching into the lymphatic system and traveling throughout the body and kind of gumming up your drainage organs, your liver and your kidneys, your lymph, things like that.
Yeah, I had that as well. I didn't have an actual rupture, but I went to do a breast exam for breast cancer called a sonocine, because you can't do mammograms with breast implants. I've had two friends in my small circle of friends that had their breast implants ruptured by mammograms. Then they can't see through the breast implants. So I had a sonocine, which is like a moving ultrasound, and they found silicone all around the tissue of my breast implants, and they were not ruptured when they were removed. And so that's what kind of prompted my decision, like, okay, these are leaking. It's time to get them out.
Mm-hmm. Yeah. And I didn't have any like evidence per se of silicone bleed or migration of silicone, other than just anecdotally, I had swollen lymph nodes like under my armpits, and they would remain like that, very tender and swollen for weeks at a time before that would finally mobilize again. And so, and then even after I had my explant, I had that same symptom on occasion, just for here and there as things were mobilizing for a good year. It takes time for all of this to get out of the body. It's not instantaneous. So we know these things travel through the lymph, and there's so much dense lymphatic tissue in the breast area that it's very easy for these things to get into the lymph and then travel through the body. And, when capsules have been studied under the microscope, they look more like lace than like a completely closed solid material. So it's like there's holes there that things can escape from. So it's definitely not uncommon to have these toxins and silicone make their way to the
yeah. And it's just more toxins for your body to deal with. And so many people's bodies, on the show, we're talking about toxins, that so many people have a really high toxic body burden. There's so many different chemicals in our environment. You just don't need this internal, constant, steady stream of toxins adding to what you're already ingesting every single day.
Exactly. And, it's not just I talk a lot about the silicone implants, but it's not just the silicone implants. Saline has its own problems. It also has, a silicone shell, and silicone is also considered a neurotoxin that chelates our neurotransmitters. And it's not just coming from breast implants. It's pervasive in the environment. We're finding it in personal care products and, all of our cooking products. And now we're getting away from plastic. We're replacing that with silicone for food storage, and it's everywhere. So it's this cumulative effect with all types of different chemicals. And in addition to the silicone shell for saline implants, they also have, the valve that is used to fill them with saline after they're placed. And it should be a one-way valve, but sometimes it's either defective upon implantation or there's some kind of trauma to the body and it becomes damaged over time, user wear maybe even. And then you have fluid flowing back and forth from the body into the implant and vice versa. And then you have a situation where microbes, and the breast tissue is not sterile, so we know there are microbes in the breast tissue, can get into the implant, can colonize the implant, it can basically act like a petri dish. And there's a recent study that was just done where they were able to culture, it was 11 different types of bacteria. And it wasn't in a super high number of patients in the sample size in the study, but, it was definitely present as an issue. And so think about how that's impacting the immune system as well. Just this chronic infection where there's probably, all these different inflammatory cytokines being recruited. And in addition to the macrophages, which are trying to gobble up the silicone. And, it's just creating so much chaos in the body.
It's a recipe for disaster. And it's sad. I have a friend of mine that had implants put in, And then she had this really, this emergency life and death situation where she was getting pain in her breasts. They got really hard. And then she had all these calcifications around the implant that then fused to her rib cage. And when the doctor went to open that up to correct it, they had to have a team of surgeons fly in to do this surgery.
Wow.
It was crazy. And then she got implants again. This same thing happened again, and she had to have them removed. This time she had to have them removed. Then she got a leukemia diagnosis, and she had the implants out and they're healed now. And she wants to get implants again.
I don't understand.
And there's a lot of women out there that are, as my friend Diane Kaiser puts it, they're dying to be beautiful. They will just do anything to, alter their bodies, have this body dysmorphia where they just don't feel attractive unless they conform this image they see in a magazine to have fuller breasts.
Yeah. Yeah. And that goes back to, I can relate to that too, because, the outward appearance was the reason I got mine placed as well. It wasn't like I had a deformity or I had cancer or, anything like that. It was really just like truly dying to be beautiful. And there was a lot of, I think, mental, emotional work that I had to, work on with myself to get to the place of deciding to explant, even though I feel like almost all along I had that gut instinct, that intuition that they were involved in what I was going through. But, I had spent so much money getting them in and I had wanted them my whole life. And, by the time they settled, I loved them and I didn't want to get rid of them. And like you, I was afraid of what I would look like afterwards. And at the end of the day, for me, what it came down to was the fact that I had had fertility struggles and we had been trying to get pregnant for 2 years and no success. And I discovered, like I said, stage 4 endometriosis. And it was this crossroads at which I thought, if these implants are contributing to all of these health issues for me, what would they do to a growing fetus inside of me or a breastfeeding baby? Because we know they bleed and there's all these chemicals and, the immune response to all of that. And I didn't want to be responsible for that. And I also didn't want to be responsible for never conceiving and, not being able to give myself and my husband our children. And, I'm still working on trying to conceive, so stage 4 endometriosis is an uphill battle with fertility. So for me, it was getting to the point of it no longer being about me and just realizing that the family that I wanted was far more important than an outward appearance. And it took learning who I really am inside to come to terms with that and be okay with it. And actually not just be okay with it, but be happy and excited about it. And just learning to love my body exactly how it was created and to see the beauty in that. And I absolutely have no regrets. And I'm very happy with the physical appearance. I love them. I just have this like newfound appreciation for my small boobs.
Yeah, I do too. I love my small boobs so much. They're not even that small. I'm like, I actually had boobs, and I just didn't know it because I had implants when I was 19, and I was skinny as a rail. I had it's just insanity. The body dysmorphia that young women developed looking at magazines and models and, that are hopelessly thin, impossibly thin. And, I had a supermodel body. I had I'm 5'10" and I was like 128 pounds or something. I had a perfect body. And yet I didn't think men would be attracted to me unless I had breasts. Complete insanity. Absolute craziness. But that was my modus operandi. I just, got implants based on that false belief.
Yeah. Same here.
Yeah. And so if someone is maybe coming to the realization that they may have breast implant illness or that their breast implants are contributing to their symptoms, what are the next steps? What should they do?
For me, I had been, mulling over this for quite some time and thinking about it. And so for me, the next step was, researching the right surgeon, to have them removed. Once I did decide to get them out, I knew I wanted to do it. I had actually been following Dr. Ursula for a couple of years. So I knew that if I made that decision, I was going to go to Costa Rica. And so it's really about, finding a surgeon that you feel confident in, that you trust, that has a proven track record of on block, explant with complete 100% capsulectomy. And so what that means is, having the implants removed with the capsules around them intact as one unit without cutting the capsules open. Because you don't know with certainty, even imaging is flawed. You don't know with certainty until you get in there whether there's a rupture or not. And you don't want to risk, especially with silicone, right? Saline is a different story. You don't want to risk all of that silicone just spilling out into the chest cavity and, even more getting into the lymphatic tissue. So I think that's really important, having them removed safely that way. And then having someone who will go back in and pick out every little last speck of capsule that's still in there after the implants have been removed, because that scar tissue that develops as your immune response to those implants. And it can continue to stimulate the immune system if it's left behind. And in addition to that, we know that the capsule also can contain bacteria and biofilm and silicone and other toxins that are kind of interwoven into that matrix. So it's just really important that the capsules come out for someone to have a really good full recovery. Right. So that finding a surgeon who has a really strong proven track record is really important. And I think, like you said, don't go discount shopping for surgeons, because it's not, in the long run, it's not going to save you money, because you're likely going to end up needing a second surgery. If things don't go well, or if you don't get better, you may want to have an exploratory surgery just to see, was it done right? Did they leave capsule behind? Things like that. And so it becomes even more expensive to try to find somebody to do it for you on a budget.
Yeah. And to make sure someone's qualified too, as I was shopping around, I went to a guy in Beverly Hills and he seemed really amazing. I discovered he was a cosmetic surgeon. He wasn't even a plastic surgeon, but they'll take your money to do the surgery if you let them.
I will say this, most surgeons who are putting implants in are not necessarily the same surgeons who are doing all of these explant surgeries properly. So if they're putting implants in, that's their bread and butter. And they're not necessarily going to believe in breast implant illness or that breast implants are causing health problems for you. They're less likely to be on board with that or admit to that. And so you want someone who believes in what you're saying, who believes in breast implant illness, and because that person is going to do the best thing for you and have your best interest in mind, rather than, a bottom dollar or just taking your money.
Yeah, I chose my doctor because he had done over 300 explant surgeries. And he did a study on them, but even he did not really believe in breast implant illness. I mean, he would tell me, I have, and I didn't come in there saying I have BII, I need help, get these out. I just said, they're leaking and I'm ready to have them out. I don't like them anymore. They're too big. And I said, but can they develop autoimmunity from breast implants? No, there's nothing in the research that supports that. He said that with absolute certainty. Well, can people develop a sensitivity to their breast implants? No, there's nothing in the research that supports that. Are breast implants toxic? Do they leach toxins into the body? No, there's no research or evidence to support that. And he just total denial. It's just like, and my thought is, if you can become sensitive to a strawberry, if you can develop a sensitivity to an eggplant, you can develop a sensitivity and a reaction to breast implants and all of the chemicals in them. So that is absolutely on its face, makes zero common sense whatsoever. You can become sensitive to any chemical or metal or fabric or food that you put into your body.
Yeah. The fact that you found someone 5 years ago who had already done that many is pretty amazing because it wasn't common knowledge back then. And you didn't have, tens of thousands, if not hundreds or thousand or more women talking about this and looking for an answer. And so that's pretty amazing in and of itself.
Yeah, I went to Dr. Stoker in Marina Del Rey, and he was a very good doctor. I'm happy with my explant. But so any other tips or steps that women should be taking if they're thinking about removing their implants?
So outside of, finding a trustworthy surgeon and interviewing more than one surgeon, I think would be really important to feel confident in your decision and your choice because they're working for you. So you want to hire somebody to remove your implants that you really trust. And as far as outside of that, I would say, doing what you can to clean up your environment, to clean up your body, starting to make diet and lifestyle changes ahead of your surgery, ahead of your explant, cleaning up the foods that you're eating, the water that you're drinking, the air that you're breathing, the things that you're bringing into the home for cleaning, for personal care, even things like if you're in the market for new carpet or new furniture or paint, or you're building a house, like think about all the different sources of toxic exposure around you and try to limit or reduce what you can. Don't stress out about all the things you can't control. Just work on the things you can control. And what you can control is what you bring into your home and what you put on your body and in your body. So reducing what's coming in is really important. And then, working on, I wouldn't do a ton of work on, detoxing and working on the gut and things like that prior to explant, because speaking from personal experience, it's only going to get you so far until you remove that huge significant source. And for some people, I will say I have had some ladies that I've worked with who have just gotten so much better. They decided, I'm not going to explant. But I wonder how many years is it going to take down the line before they're going to see a resurgence of symptoms? It's just a ticking time bomb. And so, focusing on good nutrition, organic diet, things like that, and basic support for the microbiome, opening up, supporting your drainage pathways, or as some people call them, detox pathways. So supporting your liver, supporting your kidneys, supporting your lymphatic system, basic nutrients that support methylation and glutathione production and things like that, I think are really good. It's a good starting point. And then just know that, after your explant, this is like the main message I teach people is that healing is about more than the explant. You can't expect to have the breast implants removed and then instantly be all better, miraculously healed, no problems, all your health conditions or your symptoms are gone. And you see that a lot on social media, which I think gives people this false impression that that's going to be the case for everyone. And it's just not. And, and interestingly enough, the women that I speak with, of course, are the women who either don't get better or get quite a bit better in the first month. And then, 3, 6 months, a year down the line, their symptoms return. And I think that we just don't have enough studies. We don't have enough research out there, following women long-term post-explant to know what percentage of women truly heal and get better with just the explant. We have these like 30-day, following women for 30 days, which 30 days is nothing. What's happening after that? And, maybe it's true that some people are, remaining symptom-free or significantly less symptoms for, the rest of their life. That's not the people I see.
Yeah, no, there's definitely a lot of work to be done. And so what can people expect after explant surgery? What can they look forward to?
So, for me, I don't know what you experienced, Wendy, but for me, I had done so much work before that I didn't see this like huge transformation. It wasn't super noticeable, but I did notice that I just felt less tense. I felt lighter. I felt more at peace, and other people noticed it as well. people, when I spoke with them, said you're coming across, your energy feels different. You just don't feel, you sound and you look and you feel like just softer. You have this softness to you. You're not so aggressive and tense. And so that was an interesting shift. I think, it was just causing me to remain in this state of fight or flight, and having those removed allowed my body to just take a deep breath, start to get out of that fight or flight. And so you may experience, a change in your symptoms, improvement in your symptoms, or reversal of some symptoms. I would say that, and cosmetically, it's, for some people, it can be a real shock to look at your breast for the first time. And just know, though, that over the next, up to a year, they're going to change so much. Mine changed every day for quite some time. And then, they continue to change for up to a year. So not only do we need to, work on cleaning up the downstream effect of having had breast implants, the toxicity aspect, all the, if that fact that it's feeding unwanted pathogens and cleaning up the microbiome and working on balancing that out again, and then restoring, the balance to the immune system. But we also need to take a look at what else could be contributing to this picture. And so that is also part of, what I teach people is looking beyond the breast implants. So, for me, it was looking at, what other toxic exposures do I have? I did, a lot of work looking into, do I have any mold in the home? Do I have any root canals? Do I have just any other toxic exposures I wasn't aware of? And so it does oftentimes involve looking a bit deeper so you can get the big picture of everything that's contributing to the dysregulation in the body, so that you can address all those things and relieve enough stress on the body so that it can heal itself, so that it wants to heal itself, and it will do that. So that is basically how I approach healing, is not just the explant, but not just the detox work, not just the gut work, but looking at what other stressors are contributing to this picture. And I think that's really a hugely missed factor, because, like I say, people often assume that breast implants are the only problem and that getting them out is going to solve all their problems. And it's just not the case for most people. So we have to just look at the big picture here, take stock of, other things in your life.
Yeah. And it's just the beginning. Getting the implants out, it's just the beginning. And then you have healing. Like I had drains and, for a few days after the surgery, and, it was not the easiest surgery to have, but, you get through it and you get through the pain, and, you move forward with your life. And I think it's really important to work on this emotional trauma aspect, or this,
absolutely,
this self-hatred, worthlessness, powerlessness, and other loneliness, or other kind of emotional, low frequency negative emotions and emotional traumas that women have, that contribute to them wanting the implants in the first place, or not wanting to have them removed. Because, the man that loves you is going to love your soul. He's not going to be focused on your breasts and them looking perfect. You know what I'm saying?
Absolutely.
And
absolutely.
so, yeah. And so do you work with people to help them move through this transition to removing the breast implants and healing?
Yes. So most of the people that I work with are post-explant. I work with some very, very sick ladies who have had the implants out and are still not better. And so that is the reason my focus is on not just, the downstream work, but also still continuing to dig for and discover those more upstream root causes that are also contributing to the picture, that are preventing healing. And I am working on putting together a pre-explant prep program, so that people can go into their explant, as preparing their body as much as possible for, a really good outcome, and handling the surgery really well, and, healing really well post-operatively. So that'll be coming the beginning of next year.
That's fantastic, because there's so much that you can do to prep your body. I mean, for any surgery, but especially for this one, you definitely want to be prepared so that you have, you deal with the anesthesia, and then you have the most successful chance of, healing as best that you can, having the least burden on your body. So I think that's brilliant that you're doing this. It's so needed. Any of you guys listening out there that have breast implants, you might want to think about, removing this toxic body burden, even though they look great. Like my boobs look great before I had them removed. And I was but I felt kind of matronly. I felt like I'd gained a little bit of weight and I had these big boobs. They'd gotten a lot bigger. They'd turned from C's to D's. And I just felt like they were so huge. And I felt very matronly. I felt like they made me look older, Not all women, they feel that way. They feel like their breasts look great. And that makes it even harder to make that decision. But, when your health is on the line, if you don't have your health, you don't have anything, health is wealth. So that should be your priority.
Absolutely. And I think, you look so great, Wendy. And what I typically see, it's just amazing to watch. It's almost like people reverse age.
Yes.
Getting these implants out, they just their skin starts looking brighter and less wrinkled and just more vibrant and youthful. So it's really pretty fascinating to see.
Yeah, I definitely felt better. I've continued to feel better and better and better and better since I had my implants out about 5 years ago. And really, it's just amazing how this health journey, I've been doing this for over 10 years, just with this podcast and my website. And I feel better and better and better and better. You really reap the rewards of making better decisions for your health. Sarah, thanks so much for coming on the show. Why don't you tell us where we can find you and where people can work with you if they want to remove their breast implants?
Yeah. So my website is reversingbreastimplantillness.com. And then just social media. So Facebook and Instagram is the exact same handle, Reversing Breast Implant Illness. And then you can take a look at my work and what I offer, what I do on my website. It's on the detox tab on my website. So lots of information there about exactly what you would be doing working with me, and a little bit more about my own journey as well and how I got here. So lots of resources on that website too. And so if you're looking for a surgeon, if you're looking for additional resources and support, you're early on in this journey, you might find some helpful things there for you.
Yeah, fantastic. Well, thank you so much, Sarah, for this resource that you created for women. There's going to be much, much more demand in the future for it. Yeah. I believe as women start experiencing symptoms and having just a number of different events contribute to their illness, one of them being their breast implants. So thank you so much for the work that you're doing in this and, bringing awareness to this potential underlying root cause of women's health issues.
Yeah, of course. And it's just such a pleasure. And it brings a lot of joy to my life, just seeing people get better and just claim victory over their health and be able to just take charge of that and be in control of that. It's pretty amazing. It's just very empowering.
Yes. Yeah. And absolutely. It's removing your breast implants and reclaiming your natural body is incredibly empowering, even though it doesn't seem so in the beginning before you have them out. Well, Sarah, thanks for coming on the show. And everyone, I'm Wendy Myers. Thanks so much for tuning into the Myers Detox podcast every week, where I love discussing all these different topics around how to dramatically improve your health by removing toxins and things that, emit toxins in your body. So thanks for tuning in every week. I so appreciate your presence here with me and going on this journey with you on your health. So thanks for tuning in. I'm Wendy Myers at MyersDetox.com. I will talk to you guys next week.
The Myers Detox podcast is created and hosted by Wendy Myers. This podcast is for information purposes only. Statements and views expressed on this podcast are not medical advice. This podcast, including Wendy Myers and the producers, disclaim responsibility for any possible adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. Individuals on this podcast may have direct or indirect financial interest in products or services referred to herein. If you think you have a medical problem, consult a licensed physician.